the highest for the most part. But what you want to do is you want to, because you have a details. Now you see that you're veterans. So, of course, if you're a resource base, we want to, I don't know if that was, you want to make sure that you do that because you don't want to.
And then the decision.
Which is the kind of, you need 3 out of 3. So it is
On this chart.
on, or it depends on, like this one you need 3 out of 3. This one you need 3 out of 3. This one's 2 out of 3. So depending on which type of care or setting that you're coding in, you want to be mindful to that number of components that you have to meet. Is this one a little bit easier? Think so? What do you got? What do you got? 99204. Did everyone get 99204? So did you see in the 99203 when you're looking at the table how you did have that option to select the detailed for our history, of course, right? We had a detailed history, but then our exam was comprehensive. So think about this from a resource-based perspective. Would we downcode and minimize the service? Or would we go, because we need 3 out of 3 here anyway, right? But because those other key components indicated that 99204, we can go with the comprehensive because we did have a comprehensive examination. See the rationale behind that? So instead of minimizing and going with 99203, which of course our other key components did not, they weren't applicable to that, right? So we couldn't have 3 out of 3 if we were looking at those other key components for that code.
Now, 99204 says it requires these 3 components, but you're saying we can have like 2 out of 3?
Well, it does. For 99204, let me take a look. 99204, we do have the components because we have a detailed history, but we have a comprehensive examination. In that first key component that's listed, if you take a look at it, see in that first one, we have, we do show a detailed history, but then see underneath it where we have comprehensive? That can pertain to either our history or our exam. Any one of those. Okay? Does that make sense to everyone?
Which one
So
was it?
on 99204, so for our key components, because we're grouping 2 contributory factors together in this table, we're grouping the 2. So we had, in our documentation, we have that we had a, number 6, right? So we have a detailed history. Can everybody see the detailed history in the table? It's 99203, right? But our documentation then tells us that we had a comprehensive examination, which in that first portion of the table, that covers both history and exam. 2 of our factors are listed in that table. So because our comprehensive examination outweighs the detailed history, we would go with that 99204. Because again, resource-based. So of course, we're not upcoding because our documentation still supports the assignment of this code. Yes. So 1, 2, 3. You got it. All right. is our place of service? Okay, so a skilled nursing home. So we, of course, we want to make sure that we're in the appropriate table or the appropriate section of the EM codes, right? So that's our place of service. Is our patient new or established? Established. Okay, I'll let you have a moment with this one. They get easier, but it is, if you are looking at actual documentation in the workbook exercises, you're gonna see more of the case studies like the one that I gave you. I mean, essentially, when you're evaluation of management coding, you're not looking at one-liners. You know, when you're applying those codes out there in industry, you've got a medical record. So those case studies are really good for practicing. They're really good for practicing. There's, I'm not sure if I put a link up on Blackboard, but there is a resource that I like to use for evaluation and management. It's called EM University. It's a free service. There's a lot of coding resources out there, but EM University, and you can actually, you know, enter a code and see some of the rationale. You can, you know, use it as a great resource and tool, especially when you're studying, because you can kind of, they have case studies that you can practice and play with, so it's a great tool.
I Googled something and that came up and I didn't click on it because I thought it was like one of those,
Yeah.
you know.
I think they offer either, you know, like certification prep or some classes, they may offer that, but I've used it as a resource.
I skipped right by it.
Yeah, it's a good resource, so that's a nice one. I like using that. There's a lot out there. There's a lot of free ones too. Has anybody heard of For the Record magazine? Have you subscribed to that one? You can get a free subscription For the Record magazine, and they have a lot of articles on coding in that particular magazine, and it's free. I think they do like an electronic, but you can also have a printed publication sent to your home as well if you select that. So they're good. I think there is a link for that one on Blackboard. So we do have that. Is this one a little bit more complicated, you think? Or are we getting a little bit more acclimated with these?
just recovery or something.
On
318 is just an annual nursing facility assessment.
right.
Right, but it didn't say anything about it not being an assessment.
Well, we have our MDM too, is of moderate complexity in our documentation, but in the 318, it's low, so it has two moderate.
Right.
Um,
So I think it, because it was low to moderate, it met all those three components.
I can see that, I can see that, but it's, because we can pinpoint what is occurring more with the 09, it's kind of a higher level of specificity,
Okay.
and
The visits were just a month apart, or not even.
right, well, I think it was
that's
almost
true.
a year.
That's true, it wouldn't have been.
12, oh no, yeah, month, and every
Right.
30 days, the
Right.
physician actually has to see the patient in a skilled nursing facility. They have to be seen every 30 days.
Okay, which wouldn't have been the annual nursing.
Right, right.
Right, okay, I see.
I've got a question.
Yes, Matt?
How are we to know that this is subsequent? Because I look between subsequent and initial.
Initial would be if they're actually being admitted
Would that always
to
be
the
stated?
skilled nursing facility. Once someone's admitted into a skilled nursing facility, of course, that has a higher level because you have higher levels of all the different
I
contributors.
know, but it's the fact that it's not stated, we assume that they were not admitted, that they were already in.
Well, you've got
Well, they also
the
give you
interval history, well, the interval, you've got that key term, interval,
Oh.
listed
Oh,
there.
yeah, I see.
Can you see that?
And it's a visit.
I see that now.
What was that?
No, I was just saying, she was there before, because it's got the last date that she, last. date.
Right, last date of treatment. So those are kind of like key terms, that you could actually keep an eye out for. How do you feel about these? You're just gonna take your time with them. You definitely take your time with them. Take a look at those clinical examples in Appendix C, too, if you run into some scenarios. But just, definitely, with this type of coding, it's practice, practice, practice. And you've got a few left to do for this week's homework assignment, other than the other multiple choice, so I don't wanna do them all with you. You got a couple, that way you know how you're doing too with it, so.
The physician reviewed the medical record. Is there ever a time where they can actually bill for that?
Typically, it's included in that particular service.
Yeah.
If you take a look at the descriptor with that particular code,
Yeah.
it does have, I
Oh, it
believe that
does.
it lists, yeah, I believe that it lists that is